Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. We're going to get right into it. We're here with Lou Biasi, Vice President of All County Healthcare. Lou, how are you doing? How's everything going?
Well, David, you know, in these trying times, we're doing the best we can. And what I really like to take this time, a few minutes, and I want to thank all our friends out there, all our first responders, all our nurses at all these hospitals we work with, all our friends that are doing this marvelous, marvelous job of taking care of these elderly and sick patients. We can't thank you enough. And I want to thank my own staff who's been working from out of home, working day and night to try to take care of everyone and making all these house calls, you know, and try to keep all our patients to the point where they're safe and they're sound, and we can try to avoid this terrible, terrible disease that's hitting our country. And again, I want to thank all those first responders. And I want to thank you, David, for putting the show on and trying to get this thing across what's happening. Today, we'd like to really talk about we're ready at All County Healthcare to treat all our patients. We're getting all the equipment now, the PPE equipment, David, to treat the coronavirus patients. So if they think they have coronavirus or they think they have COVID-19, whatever that is, that disease, and they don't want don't be afraid of having someone come in your house, because all our nurses right now are being covered with PPE, that's protective gear from head to toe, with gowns and masks and shields and headgear and footwear. We want to make sure you are healthy, and we want to make sure that you stay healthy. So if you have a problem, just call All County Healthcare, 954-717-7027. Now, David, Medicare said you don't have to be homebound anymore to get home care. If you think you're coming down with COVID or you have a cold and you want to be checked, make sure you call All County Healthcare at 954-717-7027. We'll try to get a nurse out there as fast as we can. And you don't even have to be Medicare. We'll treat you if you're not even a Medicare recipient. We usually take Medicare patients only, but in this circumstances, we're going out to the whole general public. So, David, that's what we're doing right now for our patients and for the citizens of South Florida, to keep them healthy and keep them out of that hospital where that disease is running rampant. If you're afraid to go to the hospital and you need some care, again, call our company. Nurses are ready to come out to see you. We have a tremendous smart staff of physical therapists, occupational therapists, speech therapists. We have a treatment now, David, as you know, that IPV treatment is a tremendous, tremendous help for those patients that might be still having a lot of congestion, bronchial congestion in their respiratory. So we'll even provide them with an IPV treatment. And we have a new mechanism. We have something else new that we are paying for at All County. We will pay for it. We're going to give you 24/7 care with our special live care monitoring system that keeps you in the home, checking your blood pressure, your oximeter, which is very important, your oxygen levels, Checks, you can check that hourly, daily. The readings come right to you and come to us. If there is a problem, we'll come out and see you right away. That's going to be put into your home for no charge.
Great news.
That's a tremendous, tremendous feature. So we're willing to pick up the total cost of that for you folks that are out there, even if you don't have COVID and you're worried about it. Just take your temperature. Our unit comes out with a complete blood pressure kit, an oximeter, a whole video system that you can call us. We'll talk to you on the phone. That's coming to you for free, just to protect. Make sure you don't get it. So, any other question you want to ask me?
Yeah, I do. I'm going to give out the number again because I was writing it down. It's 954-717-7027.
7027.
So,
right.
One of the things I wanted to ask you, so going into people's homes is nothing new for this company. I mean, you're very experienced in that, so that is already one notch in your belt loop there. But you know, that's important because there's a lot of different things that go on, and when there's a home visit, right? You're not only helping them for that issue, but you're also checking the home, make sure that there's nothing in the area where someone could fall, making sure there's food in the refrigerator, making sure that people are taking their medications, or kind of looking into that as well. So it's kind of a comprehensive process, right?
Well, our first visit, we do a complete home assessment, a complete comprehensive, like you said, David, a complete home assessment on the individual and then on the conditions at home. But that's the case you basically, on a regular home care visit. I'm talking about going over and beyond right now with COVID, where we won't get paid by Medicare because you're not a Medicare recipient, but we're willing to do that for gratis right now. When I say gratis, if you have a problem, please call us and talk to us about. I know a lot of people don't want anyone in a home because they're scared of catching COVID. And, you got to be scared. Everybody's scared. I'm scared. Everyone's scared of catching COVID. Our nurses are coming to you fully prepared with PPE, protective personal gear, equipment, protective equipment. That means they have a gown, they have a mask, they have a shield, headgear, footgear. They're not going to spread any virus to you. What
gloves,
they will
all that.
Right, and they change that and leave it at your home when they go on to the next patient. So they don't. That whole process has changed for every patient they see. The other thing is
they throw it away after. Yeah.
Right. The other thing is we're going to install a live care system, which is a telemedicine system in your home, where we'll call you daily, see you daily. Every day you can take your temperature reporter to us. Every day you can take your pulse. The pulsometer is the most important thing because you want to know what your oxygen levels are. And you also can take your blood pressure daily. So that's going to be given to you as compliments of All County Healthcare during these trying times. And I think that's a fantastic feature. That's a fantastic feature for anyone. So anyone, if you'd like to have that program installed in your house, just give us a call. 954-717-7027. And if you don't get the right response, you tell them, listen, I want to speak to Lou. Have Lou give me a call, and I'll call you as soon as I can. And what's happening, as you can see, most doctors today are using telemedicine to make their calls. Well, this is a form of telemedicine, but it goes even one step further. You have it 24/7 in your home. So you're protected 24/7 with some kind of telemedicine product that can get to our home care company right away. You can call your doctor right away and give him the results of what your oxygen levels are. Because if he's going to talk to you telemedicine, he doesn't have really the equipment to take your blood pressure, take everything. He's going to ask you how you're feeling.
I see. That's the remote inpatient monitoring that you're kind of referencing to. That's part of the process here.
Right. And if your doctor wants to pick this up for you, we can even fax all the information over to him, and he can hook you up to the system and monitor you every day. So that's an amazing, amazing product right now that we're offering to any individual in South Florida, any person that's 65 or over. We'll offer this to anyone, any individual. Don't even have to be Medicare. First time we're doing that.
All right, I'm going to give out the number again. It's 954-717-7027. They have a great staff there. I mean, you can talk with them, or Lou said you could ask for him directly. He'll get back to you. So that is above and beyond.
If you don't get the right answer from our staff and you want to call me, just say, have Lou Biasi give me a call, please. And they'll get back to me, and I'll give them a call. And I will call you back.
We're almost halfway through here, so I want to ask you another question about – so I know you have a respiratory therapist on staff. You told us about the IPV, which we'll get into a little bit more, but you also have these are nurses that go into the house or some other type of
we have a completely trained what we call respiratory team. That's made up of nurses, LPNs, and a respiratory therapist. So the most important thing, because you understand, this virus is respiratory. This is a respiratory virus. Gets into your lungs, can't breathe, and it's a terrible, terrible disease. So when they send you home, you might still have a lot of congestion in your lungs. And the IPV treatment, the interpulmonary percussive ventilation treatment, will definitely help get some of that excretion out of your lungs. We're going to give you that treatment also. So right. We'll give you that treatment. You have your own mouthpiece. We don't. That's always sanitized right after you use it. You take the whole instrument. It goes to you, and no one else can use it. So don't worry about spreading any germs.
Yeah, we had that machine on the show a year back with Ed Salazar, who's your respiratory therapist.
Ed's going to be doing your show next week. He'll explain to you more about if you have the availability for Ed to do your show next week. He will explain to you with this whole how important percussive ventilation is at this time. As you heard, the biggest problem with the hospitals were they didn't have any ventilators, right? They were using they even went going to using this what they call the CPAP machine, which is used for sleep apnea, to try to help you breathe better. This system that we have is basically similar to the same thing. If you have COPD or can't breathe, you go in the hospital. The same system they use to help you, we bring it to your home.
Yeah, I was going to say COPD, which you've been treating for decades, is got some of the I'm not saying it's the same, but it's got similar symptoms. You know, where people feel like they have an elephant on their chest, they can't breathe, and you've had this system in place. I mean, I've known you 5 years, and you already had this in place well before that. So, what I'm trying to get to, yeah, go ahead, Lou.
We're the only company that has it, David, all of South Florida. We're the only company that can treat COPD effectively, or really only treat what I could consider any kind of respiratory ailment, if you qualify, effectively, and really help the patient stay out of that hospital. We've kept patients out of the hospital for 14, 15 months, where they were basically going in some of the patients were going in every other week. So the whole purpose was to keep the patient out of the hospital, and that's what we did. So,
yeah, that's
David,
fantastic.
As you know, we're striving to give the patient every single thing that they need. And our nurses, can't thank them enough. They're going out there, they're doing their visits. Even if they have loved ones at homes, they're going out there. I know one of our nurses right now has their mother at home. She just had a serious heart operation. She still goes out there, but she's scared of bringing that virus home, like everybody else is scared of bringing it home today. But that's why we got to thank. We can't thank our nurse. This whole thing, David. As bad as it is, I think it's really showing the public how important our healthcare system's got to be, how prepared we got to be for the future, right? People don't understand the value of those nurses that go out there every single day, those doctors that work the emergency room every single day, the attendants, the CNAs, the home health aides, anybody that's working in a hospital environment today. They talk about policemen going out there being dangerous. Well, what's more dangerous than policemen worry about getting killed with a bullet? These people are getting killed with a virus, right? Don't even know that they're out there every day and have to make a decision. Am I going to bring this home to my kids? Am I going to bring this home to my family? Even my own nursing staff, they're afraid to go sometimes, but they do go because they have small children. I can't thank them enough for going. So we
and they
want
have
to,
that PPE as well that you're providing.
right,
That you said
right.
before that it's above and beyond. It's a
That's
gown.
all
You
that
said
it's taken us almost 5 weeks to gather enough PPE so we could see our patients. So we're striving to get it. We paid a lot of money for it, but we went out, we got it, and hopefully now we can start using it to see our patients. That protective gear is very important. So, that's what we're doing right now at All County. And again, we'd be one of the leaders in the community as far as healthcare. And remember, if you're going, when this is all over, those people who haven't gotten their knee surgery, haven't got their hip surgery, haven't had elective surgery, remember, when the time comes out, you're going to need home health. All the thing we ask is that you remember All County Healthcare, because it's your choice. The doctor can tell you they're going to send you somewhere else, a hospital kid, but you can tell them, listen, I want to go to All County Healthcare. We're a 4.5-star rated company, 5-star rated as far as customer service goes, 5-star rated as customer satisfaction. So you can't ask any more from a company that's been in the business for 30 years. And guess what? We're locally owned. We're not owned by a big corporation. If you want to talk to me, all you say, I want to talk to Lou. And I'll come over and I'll talk to you. I'll call you on the phone if you have a problem, which I do frequently right now.
I know David, you're working the phones all day.
Right. I start from 7 o'clock in the morning to sometimes 9, 10 o'clock at night. But I'm still there. So, David, you're doing a great job of bringing this message across to the people. Right now, trust me, don't go out. If you don't have to go out, stay home. I'm home every night. If you don't have to go out, stay at home. Lock yourself in a room if you have to. I know it's being difficult, but hey, you got to be safe. It's better be safe than sorry.
Yeah. Lou, I'm not going to complain. I've been here for 5 weeks, right here where you're seeing me for 5 weeks. But you know what? I'm just making the best of it, and we can do things like this remotely. I mean, we're a smart country, and we're figuring things out. And like your company is amazing, the things they do, and just the amount of resources you have, and going back to the IPV and then the respiratory therapist. And you mentioned LPN. I'm just going to tell everyone that's a licensed practical nurse. You also have RNs. I mean, that's a huge team. And then the experience. I just want to tell everyone, you're in Palm Beach.
We can even arrange a doctor's visit at your home if you need to see a doctor.
Yeah, I know you have a huge Rolodex of doctors, network of doctors. Right. You've worked for 3 decades.
We have a great resource for you. We have a great resource of physicians, nurses, whatever you need.
You're in Palm Beach, Broward, and Miami-Dade, right?
That's correct. We have one of the oldest licenses that covers all those 3 counties, Palm Beach, Dade, and Broward counties. So we service all the way up to, I guess the next county is what? Martin County, David, after Palm Beach?
Yep.
St. Lucie County? We service all the way up to St. Lucie County. No, we don't serve St. Lucie. We serve all of Palm Beach.
Hey, Lou, hold that thought and don't go anywhere. We're going to take a late commercial break and come back and wrap up the last 10 minutes on the Living a Longer and Healthier Life show. Stay right there, and we'll be right back.
County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. The patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Great presence on Facebook, social media. Their number is 954-717-7027. They can treat, provide treatment for the coronavirus, the COVID-19 patients with a visit to the home where they do a home assessment on the first visit as well. One of the things we talked briefly about, Lou, and this is in the news right now, elective surgeries are coming back. In fact, some states have started already, and Florida is really, I've heard, it's going to be within the next few weeks, possibly, they're going to start very gradually adding elective surgeries, which is huge, not only for the hospital groups and the doctor's offices, but for the quality of life of our residents in South Florida. One of the things you were saying is this is what you did for the last X amount of years. You did this all the time, helping people after their surgery with wound care, with rehabilitation in a way, nursing,
therapy,
right?
physical therapy, right? Everything. We did it all. We did. Persons that when they got a new hip, they called us. We gave them the therapy right at home before they could go back out to outpatient. So we took them care right at home with top physical therapists, and the outcomes were fantastic. We have some of the tops. Well, I always like to say, we're not the largest home care company in South Florida. I like to say we're the best, right? We're not the largest, but we are probably the best home care company. Our outcomes are fantastic. And really what makes me say that, because when a lot of doctors, for instance, have a problem, who do they call for their own family members? They call All County Healthcare. So we're the doctor's choice for their own family. So if they were the doctor's choice, we want to be your choice. And it's your choice that you can call All County Healthcare. We do anything from home health aides all the way up to the highest thing, from speech therapy to whatever you need. For instance, right now, if you need a home health aide, call our company, and we'll make arrangements for you to have a home health aide. We'll make because we have a number of home health aides for our subsidiaries, and we can arrange home health aides for Palm Beach, Broward, and Dade County. And if you need 4 hour with a home health aide for assistance, the prices are very reasonable. Just give us a call, and we'll be happy to help you. David, those are services we provide. I mean, it is everything we provide that a patient needs, we have. If you want to go see what else we have, please go to our website. David, you want to tell them what our website is?
Yep, it's allcountyhealthcare.com. Just put in there. There's all the services they offer, the IPV treatment. You can kind of read a little bit more about that because should read about that. It covers a lot of different ailments. We always talk about COPD with it, but we'll let Ed kind of talk a lot on that next week as we're going to have him on the program. But there's also a great library of past radio shows here because, 90% of the time we have a doctor on this show, or the other 5%, it's normally a nurse practitioner or a respiratory therapist. So we're always talking with, our healthcare heroes that are in the office or in the hospitals. They're talking to us. It gets pretty academic, pretty clinical. We get really into a lot of subjects. So there's always that. If you ever have something you want to learn a little bit more, hypothetically, we've had cardiothoracic surgeons on. If you were wanting to, you find yourself Googling a heart term or an orthopedic term, we have a whole library there. So there's a ton of info there that really explains everything. And, there's so many different things that All County Healthcare does. I'm really excited to hear about the telehealth and the remote inpatient monitoring, because that's, for our South Florida population, that is just a really big thing to offer.
And what you like to do, excuse me, David, let's say you're in your home and you're on your computer and you're browsing on a computer and you want to pass some time away, go to our website, look up and listen to our radio shows. Listen to David, listen to his guests. It's great. Go back and see, hey, listen, you want to research a cardiac patient, a respiratory therapist, you want to talk to a pulmonologist, they're all on our shows. Go to our shows and spend a half an hour just reviewing our shows. It's amazing what you will learn. It's amazing what these doctors will tell you, what's happened in the field of medicine today. So if you've watched enough television and you want to get onto something that's educational, just go to WW All County Healthcare and review David's shows.
Go ahead, David, and we're getting a lot of feedback. No, we're great. We're great. We got a lot of info out today. We're getting a lot of feedback on our Facebook broadcast. We do get, call-ins from time to time on the radio. So we are getting the word out there. Lastly, we only have a couple more minutes. So I kind of want to wrap it. I love the story, the reason you started this company. Tell us the history of All County Healthcare. I believe it started with, you saw the care that your parents were getting and you wanted to take it to another level.
Well, what happened was, David, my dad got sick and I didn't realize it. We brought him down from Boston. He was living in a unit in High Point. He went to see a physician. He got sick with dementia, and my poor mom, she couldn't handle him. And I didn't realize what dementia was at the time. None of us really did, but I knew that he needed some kind of help. So one of the hospital case managers said to me, well, you can get a home health aide. I didn't even know what a home health aide was at the time. Go down to Mayvolan, which was a senior center in Boca, which I did. They suggested to look up this company, which I did. A young lady came over. She took care of my dad. And 3 months later, I ended up buying the company. And I could see how it progressed tremendously. And I saw what these poor seniors went through. I said, listen, I'm getting older. I'm going to need some help, too. And I can tell you the difference between being treated at home, and I'm not knocking facilities, don't get me wrong, but there's nothing like your own home. There's nothing like it. Today, I think this whole COVID situation shows the value of being in your own home versus being into a facility. Again, I'm not knocking facilities. This is the right time to put you in a facility. But you can see the amount of, no matter how much care they have in these facilities, you can see how much this disease has gone through these facilities like wildfire, and how many people have passed away in these facilities. And I don't blame the facilities either. It's very, very difficult to maintain. People are still touching people, talking to people that are close, because the human race is not meant to be isolated, right? We're meant to have physical contact. And I know it's difficult with you at the present time to have physical contact, but there's no place like your home. And no matter what you do, how you do it, save enough money so you make sure if you get ill, you can stay at your home 24 hours, 7 days a week. We have care 24/7 in your home. And if you can't find or can't afford 24/7 home care, you can afford 4-hour home care. Don't forget, we got our monitoring device which stays with you 24/7. Our monitoring device is the greatest thing in the world. It's hospital at home, really, because we're checking it. It goes right to your home care company, and that's going to cost you like 11 cents an hour. Where are you going to get 24-hour home care for 11 cents an hour today?
We'll leave it at that, but I want to thank you again for being on the program.
And I want to thank you for doing the program, and stay healthy. And all our friends out there, please stay healthy.
Stay healthy and safe. We'll see you next time. Thanks, Lou.
Bye,
Thanks,
man.
everybody.
Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthy